The Gateway brings you the day's news each weekday from around the St. Louis region and the state capitals in Jefferson City.
Our schools are accredited. We don't need this bill.
And Springfield.
How many more years must pass before lawmakers see time is of the essence?
I'm Abby Larico. Join me each weekday for The Gateway on the STLPR app or wherever you get podcasts.
Coronavirus has thrown the 2020 legislative session of the Missouri General Assembly for quite a loop, and it's not clear what lawmakers will actually do when they return to Jefferson City. To get a clearer picture of the situation, Senate Majority Leader Caleb Rowden joins the latest episode of Politically Speaking. The Columbia Republican joins St. Louis Public Radio's Julie O'Donoghue, Jacqueline Driscoll, and I to talk about how coronavirus will affect major priorities and major spending in the General Assembly. Let's hit the music.
This is the Politically Speaking podcast, the definitive show about Missouri politics.
It's a little complicated in Bolivar because there is a Parsons family there.
But we also knew that it was important to make sure that we got to where we needed to go.
You know, if you walk in a room and you're getting ready to make a decision and everybody in the room looks like you need to stop.
And right now what happens in the United States Senate is as critical as anywhere else in the country.
I really want the state to succeed.
We want everybody to know that we're all working together.
I just worked hard to try to build my name where I didn't have the money.
And welcome to Politically Speaking. I'm your host, St. Louis Public Radio political correspondent Jason Rosenbaum. Joining me via the magical teleconferencing software Zoom, we have our State House correspondent,
Jacqueline Driscoll,
and St. Louis Public Radio political reporter,
Julie O'Donoghue.
And joining us from, I assume, his home in Columbia, we have Senate Majority Leader Caleb Rowden. Senator, thank you for joining us today.
Glad to be with you. I'm sitting in my my 15-month-old daughter's nursery at the moment. So
this is just the typical disclaimer we will say for all the shows. If you hear children crying or dogs barking, or do not be alarmed. This is just the new normal and under social distancing. So the reason we wanted to have you on the show today, Senator, is you're the majority leader, you're in charge of the Senate calendar, and I think a lot of people that follow Missouri politics are wondering, when will the legislature return, and should the legislature return? I think the answer to the second question is yes, but the answer to the first question seems a lot more up in the air. What do you know so far?
Yeah, so it has been a tough sort of process with a lot of voices you can imagine speaking into the process as far as how we get back, trying to be mindful of CDC guidelines, social distancing, 10 or more orders in various counties, and all of these things that are out there, balancing that with the reality that the legislature obviously has a very important job in the short term, which is to get the supplemental budget through, which includes, when it came out of the House, included $40-50 million, I think, for COVID resources. When it comes out of the Senate, because of the new stimulus bills that have passed and a number of other things, just having more information than we do now, it's going to include a lot more. And so getting that done, obviously, is of paramount importance. And so we started the process of talking to MU Health in conjunction with Boone County Public Health and Cole County Public Health on kind of a process and some resources and variables that we could put in place that would allow us to get back in the safest manner that we possibly could. Obviously, we understand that when you have 200 or 300 plus folks, if you count legislators and some staff members coming into the building from all parts of the state, your exposure is there. It's going to be there. You can't fix that, but there probably are some things that you can put in place to try and mitigate that a little bit. And so that's what we've been doing for the last couple of weeks. MU Health has been phenomenal to work with. The public health officials have been phenomenal to work with. It put together a really, really robust set of recommendations that hopefully we'll be able to implement. We've got another call today with some stakeholders just to really put pen to the paper as far as who's going to do what and how we get all of these things in place. Hopefully before next week. We obviously are supposed to be in session this week. Our goal stated goal as of now is to come back next week, at least for the purpose of passing the supplemental and probably additionally passing the FRA, which is the hospital tax. So if we get those two things done next week, we also will use next week presumably as kind of a test balloon for how some of these other things and things that we put in place as far as recommendations from MU Health, did they work? What worked? What didn't work? What do we need to improve? What doesn't need to happen, et cetera. So that's where we are as of now. As you can imagine, there's a lot of people that are interested in us coming back, and we want to make sure that we are doing it. We need to do it. We know that we need to do it, but I want to make sure also, because of the high number of at-risk individuals within the legislature, whether it be just sheer age or immune issues that we're aware of, we just want to be safe, as safe as we can. And so hopefully we can set a good example for everyone else to make sure that we're doing things the proper way.
The governor's order that the order that is put in place by the Department of Health and Senior Services that the governor told the director to issue says that, we keep gatherings to 10 or fewer people. I'm not sure if by the time you'll be in, that order will be released, or if the governor is intending on extending that. I haven't been able to get an answer on that. But how will the logistics go of the senators being in the chamber? Will you have to come in, like in waves to vote, or how? I mean, this is all very new. So how will that work?
Yeah, it's a good question. I think the technical answer for the most part is most of the orders that have been given. I know the Cole County Public Health Order that was issued, and I don't know exactly when that was, but exempts necessary government functions, or I don't know exactly what the language is. And a lot of orders do that for the purpose of, if you have to have emergency city council meetings or county commission, whatever the thing may be, or in our case, obviously the legislature meeting. With that being said, I think we are going to, yes, I do think the voting is going to look different, at least in the short term. I can't necessarily speak to what the House is going to do, although I think they're going to do it in waves, kind of as you mentioned, call a couple of folks at a time. And obviously the House's chamber is much bigger, but there's also more people. For us, we are thinking about potentially, for anybody who's watched the Senate or listened to the Senate, we call roll. Everybody votes audibly, and we may just make that roll call much, much slower. And so, if people are listening from their offices to the formalities that are being had, motions being made, et cetera, when it comes time to vote, potentially we give them time, call their name, give them a period of time for them to come up from their office to come into the chamber, make their vote, leave again, all those sorts of things. So yeah, I think we're thinking about those things and again, trying to be mindful of the guidelines and the recommendations that are being put out for social distancing. At the end of the day, we want to be a good example for everybody else, while also making sure that our work gets done.
You mentioned next week is the kind of what's on the schedule for now to return. I did on Friday get the governor to kind of pinpoint a date on when that supplemental needs to be passed. And he said the absolute last day that he thinks that, the Senate, or actually the House, could pass it, because they'll have to approve some of the changes, is April 24th. Do you think that's, a feasible date? Is that something that you guys can get done before then?
Yeah, I think so. I mean, if we go in next week, obviously we're trying to do that part at least as quickly as possible, knowing that, it's kind of a twofold reason. One, we want to get it done. We want to get it out of the way and get those resources approved. Secondly, there's at least a pretty decent chance based on the models that there's still going to be an upward tick after that. And so, I think we kind of came to the conclusion that the earlier the better, in April to get it done, just for the purpose of minimum exposure versus maximum exposure sort of thing, was also the right thing to do. So yeah, the 24th won't be an issue as far as the supplemental goes.
When I was following the debate over the supplemental in the House, I noticed that the House Democrats were criticizing the Republicans for not approving amendments putting more money into the supplemental. and you kind of alluded to this earlier, because the stimulus bill has passed and the stimulus bill has money for, I think, state and local governments, is it expected that it's going to be a much larger number than what the House passed? And if so, do you have any estimates at this point about how much money the Senate is willing to put into that bill?
What's going to happen in the Senate process is that the governor will offer amendments that will become a part of our supplemental budget that we pass out of the Senate. The amount of money, obviously, that is coming from D.C. based on 3 and maybe a 4th stimulus coming for Missouri is going to be significant. I mean, I think you're talking $3.5 billion, if not more, which obviously is a third of our general revenue spend in a year. It's not that it's insignificant. Obviously the significance of that, as far as a sheer dollar figure, is substantive. It'll take time for us to understand where that is enough and where it isn't. But I think in the short term, will all that $3.5 billion or whatever it ends up being, will it be in this supplemental? No, because we don't have all of that detail from the federal government. But it'll be a bigger number, and we're going to do everything that we can, whether it is unlocking the federal resource via additional appropriation authority, or if there's state resources that need to be expended in certain areas to fill holes, then we certainly want to be interested in that conversation as well.
Jacqueline, you said the 24th is the deadline, according to the governor, right?
Yeah, that's what he gave on Friday.
Okay, so what happens if you can't pass a supplemental budget by the 24th? Like, explain to me what that means. And the second question is, do you guys have a plan if someone in the Senate comes down with coronavirus, and if there are people that have to go into quarantine? In other words, I think that it's a likely scenario that you may lose a few people during this process.
The first question, if we were not to, the 24th is a somewhat arbitrary, although very real, drop dead date, more related to Medicaid shortage that came on the back end. It's a long story. We don't have to get into the weeds, but it isn't necessarily, that's not the drop dead date, at least from my understanding, to change the federal authority to get the stimulus money. It actually has more to do with a state Medicaid allotment that's in the budget. So, if we were to not, we would have a little bit more time technically to pass the supplemental. If we didn't pass it, we'd have to have a special session called. I mean, I think that's generally the default when it comes to budgets not being passed on time. You got to come back in immediately and pass it. And so I think that's what we would do there. The second question, yes, we do, as a part of, I think, the plan that we've been presented with and have been working on with our Senate staff and House staff and Capitol Police and the Office of Administration, the governor's office. I do think there is a plan and some recommendations as far as if someone comes to Jefferson City on, call it next Monday, and says that they're symptomatic or has a temperature, there are additional steps that we're going to take, and those are still in process. So I don't want to speak too soon on that. But yeah, I do think we understand that, just by sheer percentages, obviously there was already one state rep that tested positive, and just by sheer percentages, there will be others. And so that is a part of the conversation, trying to understand that. I do think we will probably have some senators who won't come just because of over an abundance of caution, which I understand. We had a call with our caucus last Friday, and we got everybody caught up to speed. A lot of folks were okay and ready to come back, at least for the purpose of doing the supplemental, but some weren't. And so, yeah, I think we have to be mindful of quorums. We have to be mindful that we know who's going to be there, that we have the requisite number of votes to be able to get the things done that we need to get done.
Are there any real world consequences for like a average Missourian if you guys don't pass the supplemental by the 24th?
No, I mean, for one, we're going to do it. So I'm not worried about it in that regard. Secondly, I think that there are other potential avenues that could be taken in terms of guidance that we would give the department in the short term. If there was this would be almost a doomsday-ish scenario, but there are other things that we can do. No, they shouldn't be worried. We will get it done, and we'll make sure that those resources that need to be allocated are done in the right time.
You mentioned $3 to $3.5 billion. Do you know what you would be able to spend that money on?
Yeah, so we've got a pretty good. We've had some folks do good breakdowns of where the money's headed. There's a pretty good amount of it that is aimed at specific areas. So a tremendous amount of money aimed at hospitals, a tremendous amount of money aimed at K through 12 and higher ed, corrections, some agriculture. There was a whole host of targeted stuff within those three stimulus bills, and then there is an additional $150 billion line item that basically is discretionary state money. Of which our piece of that, you can probably somewhat safely assume is going to be somewhere between probably $1.5 to $2 billion, if that's probably a conservative estimate. And so we think that that's going to be less, that there will be less strings attached to those dollars and more freedom for us to be able, and probably mostly Governor Parson and the various departments aim to be able to, really put those resources where they matter most based on what our needs are, when that money comes. So there's a lot of targeted money. Hospitals get, there's a huge line aimed at hospitals, which I think is very important. They're losing, elective surgery and a whole host of other things that they're having to push back. Now, some of that will get recouped on the back end, which is, when we're past this, which is fine. But so, yeah, there's a little bit of both. There's a lot of both, actually. So there will be a lot of money for us to be able to try and assess and fix some of these issues on the back end.
We'll be right back after this short break with Senate Majority Leader Caleb Rowden.
If you have a smart speaker, you have access to the entire world of NPR and St. Louis Public Radio. All the latest news and all the captivating stories. Activate our voices with yours by telling your smart speaker to play St. Louis Public Radio.
And we're back with Senate Majority Leader Caleb Rowden, a Republican from Columbia. I want to shift gears to the governor's handling of the COVID-19 crisis. Unlike some other states, Missouri has not issued a stay-at-home order for the entire state. It's basically been left up to local jurisdictions like St. Louis County, Boone County, Jackson County to decide whether there should be, stay-at-home orders. And I wanted to get your opinion about whether you think the governor has made the right call on that, because it has not been a universally popular decision.
Yeah, so there's a bunch of layers here. Obviously I live in Columbia, as you said. Boone County and Columbia both have been under stay-at-home order for I don't know how long, but at least a week, probably a little bit more than that now. I think one thing to consider, and not all stay-at-home orders are created equal, and so the Boone County order, I think, and the City of Columbia order was the right kind of level of restriction. If I were in the governor's shoes, which I'm glad I'm not, because obviously this is a situation. I said this last week. This is a situation we're making decisions that we never in a million years thought we would have to make, and so I'm trying to offer as much grace and understanding to everybody. I don't care who you are, because these are tough decisions. I think a stay-at-home order like the one that Columbia has in place, may very well be or have been appropriate for the state as a whole. I understand his reasoning for not doing it. The rural-urban kind of realities are what they are in Missouri. Missouri is one of the most diverse, states in the country for a whole host of reasons. I do think we have to be mindful of, and something that I think is may be lost in the conversation is what, if there is a massive surge in rural Missouri, or even, parts of rural Missouri, what that means for, hospitals in the urban areas. Obviously there will be some transition from rural to urban there, bed capacity, PPE supplies, other types of supply, all of those things. You can't look at any of these conversations within a vacuum, or kind of single one out. So, I'm hopeful that the number of cases in Missouri is rising, basically, I think, at the level that most people expected. These are not easy decisions, and I think the people who it's not a binary. It can't be a binary decision between, do we keep everybody healthy, or do we shut the economy down? Like, all of these things are very much connected, and so I think it comes down to us trying to think outside of the box in some ways, be creative and innovative, as the private sector has done in a lot of ways. And the science is what it is. The numbers are what they are. Data never lies. I think people try to skew data on for a whole host of reasons on both sides of the issue. But numbers are what they are. And so I think, I'm hopeful that the folks that are making those decisions, the governor and the folks around him, just continue to watch it really, really closely. Listen to healthcare folks around the state. And if we can flatten the curve without having to make that statewide order, then that would be fantastic. But if we can't, then I think additional action may need to be taken at some point.
Maybe a little less of a political question for you, Senator, but the first death that happened as a result of COVID-19 in Missouri took place in Boone County. The resident lived near Columbia. What was that like for you as a resident? That's your community. I assume you're a leader in that community. Did that make it more real? How was the community response to that?
Yeah, I think that's a good way to put it. It did make it real. I mean, it's been pretty real to me, from the beginning. And but when it takes that next step, and that next layer of consequence, and it's in your backyard, it does. It makes you step back and reevaluate and say, okay, what are we doing right? What are we doing wrong? What can I do? Obviously, in my situation, I felt very just handcuffed for most of this, because we're not in session. There's only so much that any one individual can do. We've tried to do a lot of information gathering and building bridges between the departments and constituents, and making sure that they have any access to any possible bit of information that would be helpful to them to get through this crisis. But it did. I think it caused our community to puff up its chest a little bit and say, hey, Columbia specifically, but the county as a whole, and I think our entire region is known for, just being a community of engaged individuals, people who come together, people who care for each other, people who have compassion, and you've seen it all over the place. I mean, that has been the uniquely positive part of this, is to watch those things play out. People who have no incentive to do some of the things that they do. They don't do it because it's a moneymaker. They don't do it because there's any publicity to be had for it. They just do it because they believe in people and they believe in this community. And so that part, in response to that death and the other things that we've seen, has been really neat to watch. I will say I got a report from the county yesterday. I think we're latest number is somewhere around 45, I think, individuals, but I think 13 or 14, I think I posted this on Twitter, 13 or 14 of those people have fully recovered now, which, so you see the number in Boone County, from my perspective, is kind of low relative to our size, and certainly to see some folks recover speaks to the reality that, maybe some of these additional measures have worked. People are being smarter about the interactions that they have. And I think all of that is that you want to be able to take the good and offer some good news, in the midst of what has been just kind of a barrage of bad news for the last month or so.
Is there any statewide plan for what to do if there's a surge in cases and the hospitals run out of beds. I know that in Illinois, they're talking about opening up McCormick Place. There's plans in New York and elsewhere to open up convention centers. I realize, New York and Chicago are not the same as Missouri, but is there any talk? I mean, on Saturday, the governor said he was going to start using the National Guard. Do we know what that looks like? If there needs to be extra capacity for patients?
Yeah, I think the question, the answer to the question is yes. There is, talks being had, plans being put together, and I think those plans are probably much further along than I'm even aware of. Part of my understanding is part of the reasoning for the National Guard declaration was just for that, just to make sure that they can begin the process of thinking about and discussing what it would look like if you did have to retrofit certain facilities for the purpose of healthcare. I'm talking to our local folks literally almost daily, MU Health and Boone specifically. For the moment, they feel okay about it. Obviously, they're watching the numbers just like anybody else, and are trying to prepare for what could be the worst and hoping for something that doesn't end up rising to that level. But I want to commend, and I do think the hospitals, the Hospital Association, the various organizations that speak for hospitals and the hospitals themselves, have really stepped up to the plate in Missouri, and they don't always get painted in the best light, sometimes as far as people's perception of them, but they're doing phenomenal work. They again, the same thing that I say about politicians or elected officials who are having to make tough decisions in tough circumstances. The same statement applies to these hospital folks. We're asking for practitioners on the front lines to go and do their job like they've always done it, knowing full well what they're walking into, and knowing better than us, even in some cases. And so, I don't have the words, nor do I have the power to offer everything that they deserve as far as thanks and resources and whatever we could do to make their jobs easier. But I'm hopeful that we can find when those opportunities exist, whether it's a state government function or something else. I want to be mindful of that, but I do think the capacity issue it could be real. Let's hope it's not, but I do think that there are a lot of people who have been engaged on just healthcare in general, but also specifically, kind of the trajectory of COVID, that are aware of this, thinking about it, putting plans together, putting plans in place and things on paper that should we get there, I'm hopeful and I think even optimistic that we'll be ready for that.
I want to ask one follow-up question. I know in St. Louis County, they're looking at using university dorms for people recovering from COVID. Is Mizzou talking about opening up dorms for people who might be patients of, coronavirus patients?
Yeah, I believe they are. And I also have heard maybe even additional thoughts on housing for healthcare providers as well. So I think all of those issues or all of those options are on the table. I haven't heard maybe a definitive movement forward quite yet, but I would assume those conversations are happening. And it's it is a good use of resources. Obviously, there's some issues on the back end that you have to deal with as far as making sure that whatever you're using is ready to get back to general use. But I think that's a risk that we should all be willing to take, and I think we can work together to make sure that when that time comes that they'll be ready for it. But yeah, I think they're talking about it, and hopefully that's something that they can work out.
Senator, I do have one question specifically to hospitals. I'm not sure if you're aware of any statewide issues, but you do say that you're talking to your health providers here locally. What we're seeing around the state is some hospitals are, dangerously low on PPE, the personal protective equipment. Are we seeing any of that issue here in Missouri or here in your local jurisdiction?
Yeah, Not as of yet, at least according to the conversation that I'm having with MU Health, and I think their plan has been really good, and has really, I think, accounted for the various ways that this thing could play out, and so where they're at now, I think is I don't want to say it's great by any means, but I think it's adequate or sufficient to continue to move forward and provide those resources for the folks that are doing this work. I think they do have models that could change that reality, but I think for the moment, as we sit here today, they're comfortable, at least and again, I can't speak for anybody else, but in mid-Missouri, I think they're comfortable with where they are, and at least comfortable with the what the next step probably is going to be. If that worsens, if you don't begin to see improvement, if you don't begin to see a flattening of the curve and continue to see that upward trajectory, then I think they have to reevaluate and have different conversations.
Beyond supplemental budget, beyond the FRA, beyond the state budget, those are requirements, that you have to get done. What is feasible to get done in addition to those things this session?
Yeah, I mean, the answer as of right now is I have no idea. I think there's a couple of things at play. For one, I want to be sensitive to a world in which we go back into session, call it mid-April, after we've done the supplemental and the FRA, and obviously probably begin work on the full budget. But you want to be mindful of your surroundings. You want to be mindful of the variables that are happening around the state. Do I think it probably is in the best interest of our state to be doing what I would call normal business, quote unquote, naming roads and, some of the more monotonous things that we do in Jefferson City while there continues to be a global pandemic going on? For me, the answer to that question is no. My dad always taught me to keep the main thing. And in this case, we know what the main thing is. And I think that doesn't mean that we won't do anything else. There are some big issues, that we put a lot, at least in the Senate, that we put a lot of weight into, PDMP and our big tort reform bill and a couple of other things. So, there could be a scenario where we try to highlight what the big ticket things are, and in combination with getting an FY21 budget passed, we try to use our time for the big stuff. But I doubt we see, and I could be wrong. Everybody, I'm only one voice. I may have a little louder voice, but I've got 23 members of a caucus and 8 on the other side who have opinions of their own. I'd be surprised if we ever get back to business as usual this year, where we come in, we're just trucking through, normal orders of business and doing, tier 2 and tier 3 type issues. I don't envision a world where that happens, partly because I don't think that we'll be past the, kind of the apex of hopefully we're past the apex by the middle of May when we were to be done with regular session. But that would surprise me a little bit if we get to that place, at least based on the world as I see it now.
Is there anything big enough to call a special session?
Yeah, I'm sure there is. I mean, certainly the anything related to the coronavirus and the response to that obviously rises to that level. Does other regular business rise to that level? I don't know. I think probably our folks would have various opinions as to what that is. I think, the pro to it is that, again, we spent a lot of time and, we stayed in overnight to get some of these things done. And we thought they were that important. The con is that we all have lives outside of the legislature, and so we give ourselves pretty wholly to our work from January to May, and then a lot of us go back home and try to make up for lost time as it relates to family time, as it relates to our jobs, and a whole host of other things. So I know that there are some who go back home in June and July and try to make a living again. And so all of those variables are at play, when it comes to deciding whether or not we're going to have a special session in summer.
The governor's budget proposal back in January, that $30 billion state budget proposal, is obviously pretty much scrapped at this point. I would say it's safe to say that there's going to be a lot of changes because of what we're dealing with. Has he offered any guidance as to like where any cuts might be or how it's going to change?
Yeah, so I think they're working through that. Obviously, they were not fully aware until last week of at least up until now, the federal money that's coming down. The positive is we started from a good place as far as COVID world. Income year over year was up over 8%, and so we were on pretty solid footing, which obviously makes this process a lot better than it would have been if we were down in revenues, et cetera. And so that's a process. Maybe we have to cut a bunch, maybe we don't have to cut quite as much as folks might think. I don't think we know the answer to that question yet, but it's something that our House and Senate appropriations folks are diving into every day to try to make sure that we're making the best and most educated, quasi guesses as we can based on the economy and all the other variables.
Well, Senator, thank you so much for joining us under these unusual circumstances. For all of our stories, stlpublicradio.org. You can follow me on Twitter at @JRosenbaum. You can follow Jacqueline on Twitter at
Driscoll NPR.
You can follow Julie on Twitter at
J.S. O'Donohue.
And you can follow Senator Rowden on Twitter at
Caleb Rowden.
Thank you very much. Until next time, so long.